Okay, hi. So I'm meeting some friends first. Thank you, Dr. Durusha, for calling me here. I'm the odd one out here. I'm a GI. I know Anita since 15 years when we started practice and we had so much free time. We went out for lunch every day to eat ice cream. Uh, Dr. Sarita Bhalera, who I speak on the telephone, but I'm getting the pleasure to meet for the first time. And Madam, pleasure to see you. I think Anita and Dr. Mazumdar has covered almost most of my talk because they not only spoke of pathogenesis, they spoke about the treatment, but I'm going to give you a GI perspective of it and let's see what we can do. I think I have about 20 minutes to talk on it. So how do we manage dysbiosis? I think the definition has been told multiple times that it's an imbalance or a disruption of the composition of the intestinal microbiota, and there is a disarray or there is a decrease in the ratio of the beneficial and harmful bacteria. We know that in the gut there are different organisms. The upper GI is usually more sterile, that is in the stomach there are less bacteria. As you come down, the bacteria in the small intestine go up to about 10 raised to 4 or 10 raised to 8. And then I think Anita mentioned something as 100 million trillion something. I don't know how many zeros that is, but I think it's 10 raised to the power of 10. That's what is those 100 million trillion. I don't know how someone counted them, but that's what they say. So what are the factors that impact our gut microbiome? It starts right from birth. That's what you have to understand. So were you born by a vaginal delivery or a C-section? That matters because in the first few weeks, the first few days, your gut microbiome is decided. Are you breastfed or bottle-fed? What were your stressors when you grew up? What diet was you had? What antibiotics you took through your life? Where you live, which city, which country, which on the mountains, on the plains, everything matters. There is data of gut microbiome from different areas in different countries, and they all have a different gut microbiome. And of course, at what stage in life you are. We've all spoke of the pathogenesis where the LPS, that is the lipopolysaccharide, leaks. But what happens in a normal person? When you eat food, your food goes into your small intestine, it interacts with bile. The bile, along with the bacteria, help to break down your food. But there are some deconjugated bile acids. These need to be absorbed in the ileum. If you remember your physiology, 99% of your bile acids gets reabsorbed. And that's why when you have normal gut bacteria, they will have normal short chain fatty acids, and this does not make the gut leaky. But when you have dysbiosis, that is the bacteria change, these bile acids cannot get deconjugated. There are other factors like genetics, diet, medications makes your gut leaky, and this lipopolysaccharide leaks into your system and causes insulin resistance. Gut microbiota has been used as a therapy in different diseases. The ones that we use commonly are in patients of Clostridium difficile and inflammatory bowel disease, but there is a role in atherosclerosis, anxiety, cancer, and now possibly PCOS is the next area where there may be a role. We saw this, the high-fat diet, the obesity, how it interacts with gut microbiota. Dr. Majumdar spoke about the hormones which are released, which act on your hunger. This affects your gut permeability and eventually PCOS. So there are multiple studies in which controls have been compared in controls and in women with PCS. And what they have basically found is that there is a decrease in the alpha diversity. That means within an area, the number of species that is present gets altered in PCOS, along with a change in the type of bacteria. So what does this change in bacteria do? They alter the short chain fatty acids, they alter the levels of the bile acid products, and they cause a change in the inflammatory or anti-inflammatory metabolites and thus affect your immunity. So when we come to treatment, you have option of lifestyle, weight loss, exercise, diet, and probiotics, prebiotics, symbiotics, and fecal mycobacteria transplant. We've all heard the definition of probiotics. They are live microorganisms which have benefits to the host. They are found in a lot of foods. And Anita said, don't drink beer because everyone's going to say, drink more beer and you're going to get probiotics. But there are randomized trials, and these multiple randomized trials have shown that probiotics, different combinations, help reduce glucose, HOMA-IR, triglycerides, VLDL, help reduce their weight, BMI, and your waist circumference. Probiotics also affect your androgens, increase estrogens, regulate your menstrual cycle, improve insulin sensitivity, and help reduce pro-inflammatory cytokines. They help to increase the gut diversity, and they change your hormonal profile and produce short-chain fatty acids. Prebiotics are fermented food which alter the composition of your gut. The commonest ones are fructooligosaccharides, inulin, galactooligosaccharides, and lactulose. They help to increase the good bacteria, that is your Bifidobacterium and Lactobacillus. And these get fermented by the probiotics to produce the short-chain fatty acids, which are essential for your gut health. And of course, this is present in our normal foods, such as leeks, asparagus, antichokes, garlic, onions, and wheat, and bananas. But these prebiotic supplements also help to control our glucose, our lipids, help in controlling the menstrual cycle, and reduce endotoxin absorption. There's something called as resistant starch, which refers to the portion of starch that the bacteria do not get or cannot act on. And these foods, there's a whole lot of foods like green bananas, plantains, beans, peas, lentils, which help to reduce or improve the glucose profile, cholesterol, HDL, menstrual cycle, and reduce your waist and BMI. But there aren't any studies to tell us whether they actually change your gut microbiome or do they have a benefit through another mechanism. Symbiotics are a combination of prebiotics and probiotics. They also help increase the short-chain fatty acids and help decrease the gene expression on the inflammatory markers. And they help improve metabolic syndrome. These are the long list of randomized trials which have been used in probiotics and prebiotics. But the question you will ask me is, if there are so many trials, why aren't we using them for our PCOS patients? Because the results of the studies have been inconsistent. A lot of them have been in rats, like Anita said. And some studies show increase in certain species, but they decrease in the other species. And why they happen, what is the exact pathophysiology mechanism is not known. And how the gut microbiome changes with the various phenotypes, we do not know. And please understand that the actions and characteristics of these probiotics are strain and genus specific. So just because one lactobacillus is used, that doesn't mean any lactobacillus molecule is going to work. So we need more studies for them to be recommended as a routine. Now coming to what we do, fecal mycobacteria transplant. Exactly as the word says, it is giving shit from one person to the other. Do we do it? Yes, we do it. Have we been doing it? For the last 10 years. If you come to our endoscopy department at Jaslok Hospital, in the corner you will see one Jaipan mixie which is lying. If anybody flicks it, he will not know that that is used to form a slurry of the donor stool. Okay? Do we tell the recipient to ingest it orally? No. After we make a slurry, we use the colonoscope and we deposit this in the entire colon. Who donates? The spouse donates. The spouse gets bragging rights. I gave my spouse shit and he had to keep it. All right? That's exactly what happens. So, of course, we test them for all the possible viruses, bacteria, parasites, infections. We tell the donor to donate stool, we mix it with saline, and then we infuse that into the colon. It's life-saving. So it's life-saving in patients with recurrent sick patients in ICU with severe Clostridium infection who are not responding to therapy, in a few cases of severe inflammatory bowel disease. That's where we predominantly used it. But if you go back to history, you'll see that right in the earliest centuries, there's been history of there being fecal microbiota transplant. But the main thing, I think, came in World War II. I don't think there's there's a marker here. In World War II, I think the German soldiers were said to eat camel stools because that was the treatment for dysentery. Because please understand, World War II occurred before the penicillin antibiotic era. There were soldiers who were dying. So stool from animal was given to the soldiers to try to save them. Also, as we went along, it was realized somewhere in the 90s and early 2000s that you could do a fecal mycobacteria transplant, but when you did that, you transferred certain genetic factors to the recipient. So when in patients of Clostridium difficile were given, if the spouse was obese, they got certain characteristics of obesity or insulin resistance. All right? So some of the features were passed on with the FMT. All right? Also, the reverse happens true. So if your spouse is thinner and you are obese, it may help to improve your peripheral sensitivity. There were some studies, I think by Goa et al., which showed that FMT improved PCOS in rats. No human studies yet. So a lot of things were discussed on lifestyle. But what do you tell your patient? We just keep saying lifestyle, lifestyle. But what do you tell? I tell them, do you have an app? Everybody has a mobile phone. Do you have an app? And how many steps do you walk? Do you walk your 10,000 steps? If you want to maintain weight, you have to walk 10,000. If you want to lose weight, you have to walk 15,000 per day. And you can't say that you are only... Oh, sorry. Typo. 15,000. Sorry. 15,000. So if you want to lose weight, it is 15,000. All right? But when we say 10,000, you can't say, oh, I exercise every day, but whole day I'm sitting and watching television. Because a lot of people are at home and not necessarily working. They do say that at least 30% of your steps should be in daytime activity. You may have the money, you may have the resources, walk across the street to pick up your bread or your eggs because you need to do the steps. You need to do 3,000 steps in your work and you need to do another 7,000 to 8,000 steps as part of your exercise. That's about 30 minutes, at least 5 times a week. We need to do muscle training because muscle uses the calories. So do that at least 2 to 3 times a week. Make sensible goals. If you lose 5% of your body weight, that also improves sensitivity. You are 100 kilos, your ideal body weight is 60. If you tell them you have to lose 40 kilos, they're not going to come back to you. They're not going to lose any weight. But if the short-term goal is lose 5%, just 5% is only 5 kilos. That's reachable. It is achievable. And that's what you need to aim for. Please understand that diet is more important than exercise. 80% of weight loss is based on diet. Reduce, as they've all said, for PCOS, reduce the sugar, reduce the salt, reduce the fat, and reduce the carbohydrate. Avoid all packaged goods and don't follow any diet fads. The gut and the microbiota, what happens when you diet? If you have an energy-restricted diet, a vegetarian diet, it is beneficial. It helps reduce your metabolic syndrome by altering the gut microbiota. There's also a lot of talk on chemical exposure. I'm not sure whether I missed any of the talks in the morning which may have covered this. So the type of food you use, fresh food rather than processed, reduce plastic containers, reduce personal care products. I know I'm talking to more women here, but personal care products. Reduce purchase of newly produced furniture, fabrics, non-stick frying pans while the women are pregnant or nursing. Avoid the use of pesticides at home. Avoid paint fumes. Avoid taking painkillers as far as possible. And do not assume that all Ayurvedic, homeopathic, or natural products are safe, because they are not safe. They are only telling you half the story. So in conclusion, the metabolic, the reproductive, and the phenotypic features of PCOS are all modifiable and reversible by lifestyle interventions, irrespective of the pathogenesis. The only problem with our patients is absolutely nobody wants to do it. Everybody wants a surgery or a medicine or a quick fix to get rid of their problem. So far, as I think one of the foreign speakers spoke also, the current PCOS guidelines do not recommend any probiotic supplementation or proof to say. So that's, you should not go away from this topic saying that from tomorrow I'm going to prescribe probiotics. It still remains on the lifestyle and the other drugs that you have. It's still work in progress.